Welcome to WGU Prep YouTube channel. Access all practice questions. Comprehensive Health Assessment. Practice questions with answers. Question 1. Which of the following is the best method for assessing lung sounds? A. Auscultation. B. Palpation. C. Percussion. D. Inspection. Which one is the correct answer? The correct answer is A. Auscultation. Explanation. Auscultation is the best method for listening to lung sounds and assessing respiratory function. It involves using a stethoscope to listen to breath sounds. Question 2. What is the purpose of the APGAR score in a newborn assessment? A. Determine newborn health. B. Assess neurological function. C. Measure respiratory function. D. Evaluate physical growth. Which one is the correct answer? The correct answer is A. Determine newborn health. Explanation. The APGAR score is used to evaluate the overall health of a newborn, including heart rate, respiratory effort, muscle tone, reflex response, and skin color. Question 3. Which of the following is a primary indicator of dehydration in adults? A. Dry skin. B. Weight loss. C. Increased urine output. D. Tachycardia. Which one is the correct answer? The correct answer is A. Dry skin. Explanation. Dehydration is commonly indicated by dry skin, decreased urine output, and other signs of fluid imbalance, with tachycardia often accompanying it as the heart tries to compensate. Question 4. What is the first step in a comprehensive health assessment? A. Health history. B. Physical examination. C. Laboratory tests. D. Vital signs assessment. Which one is the correct answer? The correct answer is A. Health history. Explanation. A health history is typically gathered first in a comprehensive assessment to understand the patient's medical background and current concerns before moving on to a physical exam. Question 5. Which of the following is assessed during the head and neck examination? A. Cranial nerve function. B. Heart sounds. C. Respiratory rate. D. Abdomen tenderness. Which one is the correct answer? The correct answer is A. Cranial nerve function. Explanation. The head and neck examination includes assessing the cranial nerves for function, which helps detect neurological issues. Question 6. What is the best technique for assessing peripheral pulses? A. Light palpation. B. Deep palpation. C. Palpation and auscultation. D. Visual inspection. Which one is the correct answer? The correct answer is A. Light palpation. Explanation. Palpation, especially light palpation, is used to assess the strength, rhythm, and regularity of peripheral pulses in the extremities. Question 7. Which of the following is the most accurate method for assessing a patient's blood pressure? A. Auscultation. B. Palpation. C. Digital measurement. D. Observation. Which one is the correct answer? The correct answer is A. Auscultation. Explanation. Auscultation using a sphygmomanometer and stethoscope is considered the most accurate method for assessing blood pressure, allowing for clear detection of systolic and diastolic values. Question 8. Which assessment finding is most concerning in an adult patient with shortness of breath? A. Use of accessory muscles. B. Respiratory rate of 18 breaths, min. C. Oxygen saturation of 95%. D. Clear lung sounds. Which one is the correct answer? The correct answer is A. Use of accessory muscles. Explanation. The use of accessory muscles is concerning, as it indicates increased work of breathing, which may point to respiratory distress or hypoxia. Question 9. What is the best technique for assessing abdominal tenderness? A. Light palpation. B. Deep palpation. C. Percussion. D. Auscultation. Which one is the correct answer? The correct answer is A. Light palpation. Explanation. Light palpation is used to assess abdominal tenderness without causing further discomfort, followed by deep palpation if no tenderness is present. Question 10. Which of the following is a key aspect of assessing neurological function? A. Pupil reaction. B. Blood pressure. C. Respiratory rate. D. Skin color. Which one is the correct answer? The correct answer is A. Pupil reaction. Explanation. Pupil reaction, including response to light and accommodation, is an important neurological assessment to check for proper brainstem function and response to stimuli. Thank you for watching. For more practice questions, subscribe to our website at WGUPracticeQuestions.com.